Unit 1, Target 1, Anatomical Terminology, Directional Terms. What is anatomical terminology and why is it important? Anatomical terminology is a standard set of words used to describe locations of the body parts. These terms help doctors, scientists, and students communicate clearly about body, avoiding confusion. Instead of saying something is above or next to something else, we use precise or exact terms that always mean the same thing. This is especially important in medical and anatomy because small mistakes in communication can have serious consequences. For example, if a surgeon told incision should be made on the right side of the patient, they need to make sure that right means the patient's right, not the doctor's right. That's why we refer to the body in anatomical position, standing up, facing forward with the arms at sides, palms facing out. The key directional terms and how they work is directional terms help describe where one body part is in relation to another. Here's some of the more important ones. Superior versus inferior. Superior means above. Example, the head is superior to the neck. Inferior means below. Example, the stomach is inferior to the heart. Anterior versus posterior. Anterior or ventral means towards the front. Examples, the chest is anterior to the spine. Posterior or dorsal means towards the back. Example, the brain is posterior to the eyes. Medial or lateral. Medial means closer to the midline of the body. Example, the nose is medial to the ears. Lateral means further away from the midline. Example, the arms are lateral to the chest. Proximal versus distal, which is mainly used for arms and legs. Proximal means closer to where the limbs are attached to the body. Example, the shoulder is proximal to the hand. Distal means further away from where the limb attaches. Examples, the fingers are distal to the elbow. Superficial versus deep. Superficial means closer to the surface of the body. Example, the skin is superficial to the bones. And then deep means further inside the bodies, like the lungs are deep to the rib cage. How this relates to homeostasis is a way of body keeping everything stable and balanced. Directional terms are useful in describing how different body parts work together to maintain homeostasis. For example, the brain superior controls body temp. Make sure we don't get too hot or too cold. The heart medial pumps blood, delivers oxygen to all parts of the body. The kidneys posterior and inferior filter waste, preventing harmful substances from building up. These systems all work together, and knowing their exact location helps doctors and scientists understand how the body maintains balance. How the structures of the body helps their function. The position and shape of body parts allow them to work properly. For example, the spinal cord is located posteriorly to protect it while still allowing movement. The lungs are lateral to the heart, so they have space to expand when breathing. The stomach is inferior to the heart, allowing food to be broken down before nutrients are carried through the blood. Each part of the body is placed in a way that helps it do its job effectively. So the class activity that helped me understand at the beginning of this unit, I didn't really understand much, but I knew that directional terms were used to describe locations in the body, but I didn't fully understand why they were in the way they are, or how they connected to each other, like their definitions and stuff. To improve my understanding, when we had the Unit 1 targets due in the notebook check, I had to research it through the lab manuals and the notes that we took. So I used that to clearly write down what my understanding of it was. I used flashcards and memorization games, both digital and physical, to practice the definitions and test myself. And then I broke down the words' meanings. I learned like superior comes from Latin words, making them easier to remember. Through this process, I realized that directional terms followed a logical pattern, and they're named based on their position relative to the rest of the body, which really helped me understand what they meant and how they were used. Sorry, excuse me. Why is this important? Understanding anatomical terminology is essential for anyone studying the human body. These terms provide clear communication in healthcare and science, help describe body structures accurately, and support the understanding of how the body parts work together. By practicing with flashcards, class notes, and memorization games, I was able to go from just recognizing terms to fully understanding them and applying them in tests, in other like labs and other notes, and in my day-to-day life. Before this unit, I didn't realize what it meant, so doing this unit really helped me understand the terms that help the body clearly be described and precisely be described. And then it helped me learn about other body systems and other medical terminology. Unit 1, Target 2, Anatomical Position and its Importance. What is anatomical position and why does it matter? The anatomical position is a standard like reference position used in anatomy. It ensures that everyone describes the body in the same way no matter how it's positioned. The anatomical position is defined standing upright, feet together or slightly apart, palms at sides, arms facing at sides, and then palms facing forwards, head and eyes facing straight ahead. This position might seem simple, but it's very important for communication, medical, and scientific fields. Without a clear reference, understanding or describing the locations of body parts would be confusing. For example, if somebody's lying down or upside down, the terms above or below wouldn't always make sense. But we use anatomical position as our reference. Terms like superior, inferior, anterior, and posterior stay consistent no matter how the body is positioned. Why is anatomical position important? Clear communication. Doctors, nurses, and scientists need a universal system to describe the body. If one of the doctors says a wound is on the right side, everyone must agree on what right means. In anatomical position, right always refers to the patient's right, not the observer's. Avoiding mistakes in healthcare, in surgery and medical imaging, small misunderstandings can lead to serious errors. If a surgeon needs to operate on the left kidney, they must be 100% sure which side is left. This is why anatomical position never changes. Consistency in learning and research. Textbooks, diagrams, and research studies all follow anatomical position so students and professionals can comprehend without confusion. Sorry about that. How it relates to homeostasis. Homeostasis is the body's way of maintaining stable internal environment or a steady state. The anatomical position helps by ensuring consistency in how we describe organs and their functions. For example, blood circulation depends on the heart being located in a medial and slightly left position. If its location were described differently each time, it would be difficult to study how the blood's pumped effectively. The body temp regulation involves structures like sweat glands in the epidermis and blood vessels in the dermis. Their positions are always described relative to anatomical position, making it easier to understand how they work. how the structures of the body support their function. The position of the body and anatomical positions help them work properly. The lungs are lateral to the heart, allowing for space for breathing. The spine is posterior to the internal organs, protecting them while supporting movement. Arms and legs are positioned symmetrically, allowing for balanced movement and coordination. If we didn't have a standard way to describe these structures, it'd be difficult to explain how they function together. Like, it'd be hard to explain how the heart pumped blood all over the body, or how the brain delivered signals from its brain to all the way to its feet to take a step. The class activity that helped me understand was doing the language of anatomy notes. Sorry about that. It helped me like clearly visualize what each anatomical position meant and how it looked. And then Mr. Mimio like drew like an anatomical correct person on the whiteboard, which also helped me. It was easier to like visualize while doing a fun hands-on activity, and understanding why it would make more sense to have a generalized basically basis for anatomical position rather than having just any whichever way, because doctors can make mistakes on which kidney or which arm to cut off. So it helped me understand making like studying and easier, and how the body is described in anatomical position. This is important because learning about the body structures are very important, especially in medical fields, scientific fields, and it helps avoid confusion when discussing anatomy. And then because of this, anatomical position is used in every medical textbook, hospital, and scientific study worldwide. So before this, I knew that anatomical position was important, but I didn't understand why it had to be so specific. Now I understand why it has to be the exact same thing every time, which helps learn and understand the body and prevents mistakes from happening and increases accuracy. I learned this through the language of anatomy notes and the activities with Mr. Mimio. Unit 1, Target 3, Anatomical Planes and Body Cavities. What are anatomical planes and body cavities? When we study the human body, we need a way to describe how it's divided and where the organs are located. This is where anatomical planes and body cavities come in. Anatomical planes are imaginary flat surfaces that divide body into sections. These help when studying anatomy, taking medical images like MRIs or CT scans, or performing surgeries. Body cavities are large spaces within the body that house, protect vital organs. These cavities allow movements, cushion delicate structures, and create compartments for different organ systems. Together, anatomical planes and body cavities make it easier to locate and study and treat different parts of the body. There are three major anatomical planes described to how the body is divided. The transverse or horizontal plane divides body into top, superior, and bottom, inferior halves, commonly used in CT scans and MRI imaging to view cross sections of organs. An example is a CT scan of the brain. It slices into upper and lower parts, showing like abnormalities more clearly. Excuse me. Frontal or coronal plane divides the body into front anterior and back posterior sections. Using medical imaging and movement analysis, watching posture and physical therapy. Example is a chest X-ray, often used in the frontal plane to show the lungs, heart, and rib cage. The mid-sagittal or median plane divides body into equal left and right halves, helping study symmetry and function of paired organs like the kidneys or lungs. Example is a sagittal MRI of the brain, shows how the left and right hemispheres are connected. This is important because it allows health professors to take clear images and diagnose conditions accurately. Surgeons use these planes when planning procedures to avoid damaging critical structures. Body cavities are large fluid-filled spaces that hold major organs and allow them to function properly. The first one is dorsal cavity, the backside. It contains two subdivisions: the cranial cavity, which holds the brain and protects the skull, and spinal cavity, which holds the spinal cord and protects the vertebrae. It's important because the spine and the brain cord are highly sensitive, so the bones surrounding them provide extra protection. The second one is ventral cavity or front side. This is the largest body cavity. It's divided into thoracic cavity, which is the chest, holds the heart, lung, esophagus, and major blood vessels. The rib cage and sternum protect these vital organs. The abdominopelvic cavity, abdomen and pelvis, contain the stomach, intestines, liver, kidneys, bladder, and reproductive organs. Separated from the thoracic cavity by the diaphragm, a muscle that helps with breathing. It's important because ventral cavity allows organ movement, the stomach expanding when eating. It provides space and protection for important functions like digestion, circulation, and reproduction. How these relate to homeostasis. The division of the body into planes and cavities help maintain homeostasis by keeping organs in places and separating different functions. The thoracic cavity protects the lungs and heart, which work together to regulate oxygen levels and blood circulation. The cranial cavity shields the brain, which controls body temperature, breathing, and other homeostatic processes. The abdominal cavity houses digestive organs, ensures the body gets nutrients when keeping waste separate. Without body cavities and anatomical planes, it would be much harder for the body to maintain stable conditions and for us to understand different parts of the body. How structure supports function. The organization of the body cavities directly supports how organs function. The rib cage protects the delicate lungs and heart, but still allows them to expand and contract. The diaphragm separates the chest from the abdomen, making breathing more efficient. The brain is enclosed in the skull, providing the highest level of protection because it controls the entire body. The anatomical planes help by guiding medical imaging. Doctors can get clear cross-section of the body to diagnose diseases, helping surgeons navigate the body safely. They know exactly where to operate. Without these divisions, the body wouldn't function as smoothly. The class activity that helped me understand this was Lab Manual 1, The Language of Anatomy, and it was on the page where it shows like the 3 clear planes of the body. This helped me visualize and learn the 3 parts of the planes. And then also on the same one, the dorsal body cavity and the ventral body cavity, it shows like the cranial cavity, spinal cavity, thoracic, abdominal, and pelvic cavity. This helped me visualize also and see what organs were inside the cavities and see how visually it was arranged. This is important because interpreting medical images like MRIs and CT scans, studying how organs interact in different sections of the body, performing surgeries and medical procedures safely. Because of this, every doctor, nurse, or physical therapist or medical research needs to understand these concepts, to understand and perform correctly on the people or the bodies they are trying to understand. Unit 1, Target 4, Homeostasis and Feedback Loops. What is homeostasis? Every organism must maintain a stable internal environment, even when the external environment is constantly changing. This process is called homeostasis, or steady state. The body has built-in systems that detect and respond to changes to keep everything functioning properly. This is done through feedback loops, which help the body stay within a healthy range for things like body temp, blood sugar levels, oxygen level, blood pressure. Without homeostasis, our bodies wouldn't be able to function properly, and even small imbalances could lead to serious health issues. How does the body maintain balance? The body uses two main types of feedback loops to regulate internal conditions. Negative feedback loops, bringing the body back to normal. The negative feedback is most common type of homeostatic regulation. It works by reversing a change in the body to bring it back to a normal state. Example of this would be body temp regulation. If the body rises above normal, the body sweats to cool down. If the body temp drops too low, the body shivers to generate heat. Once the body reaches the correct temperature, the response stops. Another example is blood sugar control. After eating, blood sugar level rises. The pancreas releases insulin, which helps cells absorb the sugar. Once the blood sugar levels return to normal, insulin release stops. It's important because it prevents dangerous fluctuations in body conditions and maintains balance and stability, keeping the body functioning properly. The second type is positive feedback loops, amplifying a process until it's completed. Positive feedback is less common, but it occurs when the body intensifies a process until a specific goal is reached. Instead of reversing a change, it pushes it further. An example is like blood clotting. Blood clotting is when a blood vessel is injured, platelets stick to the damaged area. These platelets release chemicals that attract more platelets. The cycle continues until the wound is sealed. Another one is childbirth or labor contractions. The hormone oxytocin triggers contractions. Each contraction releases more oxytocin, causing stronger contractions. This continues until the baby is born, and then the process stops. This is important because it helps process quickly and effectively and used when rapid action is necessary, such as stopping bleeding or giving birth. How does homeostasis relate to the entire body? Every organ plays a role in maintaining homeostasis. The nervous system detects changes and sends correct signals to them. The endocrine system releases hormones to regulate body conditions. The circulatory system transports oxygens, nutrients, and hormones. The respiratory system controls oxygen intake and carbon dioxide removal. The urinary system removes waste and maintains fluid balance. These systems work together to keep the body stable even under extreme conditions. How structure supports function. The structure of an organ and system is perfectly designed to support homeostasis. The brain, or the hypothalamus, acts as a control center, monitor changing and sending signals to adjust the body's functions. And basically, the pancreas releases insulin and glucagon to regulate the blood sugar, and then the sweat glands and muscles help regulate body temp through evaporation or sweating, or heat generation, which is shivering. The kidneys filter blood, removing waste like while keeping important nutrients. Without these specialized structures, the body wouldn't be able to maintain balance. How this deepened my understanding. At the beginning, I didn't really understand why the body did what it did. Like, why I understood that the body sweated to get the temp back to normal, or why we shivered when it got cold. I understood that much, but I didn't really understand fully. And I learned what homeostasis was through the homeostasis station lab that we did as a class. And through the lab, I slowly learned how each part of the body is constantly trying to achieve homeostasis. And through this, I learned how there were two different types, positive and negative, and how they amplified or reversed the cause to get the body back to normal. This is important because to understand homeostasis and feedback loops is very important because it explains how our body stays healthy. It helps us understand what happens when homeostasis fails, like in diabetes or like a heat stroke. It is used in medicine, sports, and health science to improve treatments and performance. So, homeostasis is one of the most important things of the body, if not the most important, to ensure that you, as in the human, are at normal body levels. Unit 1, Target 5, Body Systems and Their Functions. Why do we need body systems? Human body is a complex machine, and just like a machine, it has different parts that work together. Our body has multiple systems that keep us alive and functioning. Each body system has a specific job, but they also interact with each other to maintain balance or homeostasis. Before this unit, I understood that there were multiple systems, but I didn't know how they interacted or why each was necessary. Through research, class activities, and other like memorization stuff I gained a deeper understanding of how each system worked and its function. The 11 major systems and their functions are: number 1, the integumentary system, the skin, hair, and nails. Their function is acts as a protective barrier against infections, UV radiation, dehydrations, helps regulate body temp through sweating, contains sensory receptors to detect pain, touch, and temp. Key organs are skin, largest in the human body. Hair and nails provide additional protection, and glands produce sweat and oil. It helps regulate a body temp by sweating when it's hot and constricting blood vessels when it's cold. The skeletal systems is the bones and joints. It provides structure and support to the body. It protects vital organs. The skull protects the brain. Ribs protects the lungs and heart. Produces blood cells in the bone marrow and stores minerals like calcium. The key structures are bones, joints, and ligaments. And bones store minerals like calcium, which the body can use when needed to maintain balance. The muscular system, the muscles and tendons, allows movement by contracting and relaxing, maintains posture, and stabilizes joints. Generates heat through muscle activity. Types of muscles: there's skeletal muscle, voluntary, used for movement; cardiac muscle, involuntary, found in the heart; smooth muscle, that is involuntary and found in organs. Muscles generate heat to help regulate body temp and maintain posture. The nervous system, brain, spinal cord, and nerves controls all body functions by sending electrical systems. It processes information from environment. Initial response to maintain balance, like reflexes or pain response. The key structures are brain, spinal cord, and nerves. It constantly monitors internal conditions in response to changes, adjusting heart rate when exercising. That's like an example. The endocrine system, hormones, and glands. It regulates body functions through hormones, helps control growth, metabolism, and reproduction. Key organs are like the pituitary gland, the thyroid gland, or the thyroid, the pancreas, and hormones help maintain blood sugar, growth, stress response, and other functions. The circulatory system, the heart and blood vessels, transport oxygen, nutrients, and hormones throughout the body, remove waste products like CO2, regulate body temp by adjusting blood flow, and then the heart, blood vessels, and blood are the key organs, and then it delivers essential materials in removing waste, keeping cells functioning properly. The respiratory system, the lung and the airways, supplies oxygen, removes carbon dioxide, and then helps with speech by controlling airflow. And then key organs are lungs and trachea and bronchi, and then carries balances oxygen and CO2 levels, preventing dangerous conditions like hypoxia. The digestive system, stomach and intestines, breaks down food, absorbs the nutrients, and eliminates waste. The stomach and intestines are the organs, and then it helps cells get the energy and nutrients they need to function properly. And then urinary system, kidneys and bladder, filters waste to remove filters blood to remove waste, regulates water balance, maintains blood pressure and salt levels. The kidneys and bladders, proper balance of fluids and electrolytes in the body. Immune system, white blood cells and lymph nodes. Defend the body against infections, diseases. Removes harmful bacteria and viruses, white blood cells, and lymph nodes. They prevent infections that could disrupt the body's internal balance and reproductive system, male and female organs. Produces offspring, produces hormones, the testes and ovaries, and then hormone levels necessary for overall body function. At the start of the unit, I knew that there were some like body systems, like I knew that we had sweating, respiratory, and for breathing, and heart rate, and blood pressure, and stuff like that. But until I did the human body system / function notes in the notebook on page 17, I didn't fully understand it because I didn't really know what each did. And after I took these notes and with the clear slides, it helped me organize my thoughts and fully understand what each body system did and what its function was and how it related all together to produce homeostasis. Unit 1, Target 6, Classification of Tissues. The human body is made of trillions of cells, but those cells don't just exist randomly. They're organized into tissues. These tissues are groups of similar cells that work together to form specific functions. Tissues are the building blocks of organs. They have unique structures to match its functions, and then they work together. The four main types of tissues are in the human body. We focus on epithelial, muscle, and connective tissue. The epithelial tissue covers and protects bodies. Lines organs, absorbs and secretes substances. An example would be skin, the lining of the stomach. Muscle tissue allows movement by contracting and relaxing skeletal muscles. Heart and intestines. Connective tissue supports, binds, and protects other tissues, organs. Bones, blood, fat, and tendons. Epithelial tissue is a protective barrier on the body surface. It helps with absorption, secretion, and sensation. Some epithelial tissue have cilia or microvilli to move substances or increase absorption. They're tightly packed cells that form sheets. There's no direct blood supply, and can be single layered, simple, or multi-layered stratified for extra protection. Skin in the epidermis, lining of tendons, or lungs, alveolar lining. It protects the body from infections, absorbs nutrients, regulates temp. Muscle tissues, the body and blood of internal organs, it moves them, contracts and relaxes to create force, maintains posture and generate heats. Made up of muscle fibers and proteins, actin and myosin. To create movement, there are 3 types of muscle tissue: skeletal, cardiac, and smooth. Skeletal attaches to bones, voluntary, and examples would be bicep or tricep. Cardiac is heart, involuntary, and in the heart walls. Smooth is internal organs, involuntary, and stomach and intestines. Connective tissue, it provides support, structure, and connection between body parts, stores energy in fat, and transport materials, which is blood, and then helps with the protection of bone, cartilage, and immune white blood cells. The structure, cells made in matrix, solid or liquid, or gel-like, has fibers, collagen, elastin for strength and flexibility. Types of collagen connective tissue: bone provides structural support and movement, like the femur or skull. Cartilage reduces friction in joints. Nose, ears, between bones. Tendons and ligaments: tendons attached to muscles, to bones, ligaments connecting bones to bones, like in the Achilles tendon. Blood transports oxygen, nutrients, and waste to red blood and white blood cells. Adipose, which is fat, stores energy, insulates the body, and it's the fat beneath the skin. And how it connects to homeostasis: it supports, protects, and nourishes other tissues, keeping the body functioning efficiently. At the start of the unit, I did not know that there were like 3 tissue types. I knew that there was muscle, and then skeletal, and then I knew that there were different types of tissues, but I didn't really know what they were. And I learned them through the tissue lab and tissue lab number and the tissue notes 1 and 2, because it was easy to visualize, and it was simple because I had to draw like the squamous, cuboidal, and columnar tissues for epithelial tissue. Then I got to list out what the 4 tissue types were. And then I also drew like simple and stratified cells, and then I got to put it all in a summary that was easy for me to understand. And it helped me increase my knowledge. Also, the microscope lab also helped, because I got to see what they actually look like, and not just drawings or pictures. And I got to see the real world experience of what they truly look like. And through those, I was able to understand better what epithelial tissue, muscle tissue, and connective tissue was, and how it looked, and how it its form worked with its function. And tissues are the foundation of the human body. Without them, our organ systems wouldn't function properly. Learning about them helps explain to me how the body's built and how it works and how it maintains homeostasis every day. Unit 2, Target 1, Integumentary System. The integumentary system, which includes the skin, hair, nails, and glands, and is the body's first line of defense against the environment. The skin is the largest organ in the human body and plays a vital role in protection, sensation, temperature regulation, and homeostasis. There are 3 layers of the skin. The epidermis, which is the outermost layer, its function is protection, waterproofing, and production of melanin. And then example are keratin and melanocytes. The dermis, which is the middle layer, its function is sensation, temp regulation, and strength. Examples are like the nerve endings, sweat glands, and blood vessels. The hypodermis or subcutaneous layer is the deepest layer, and its function is insulation, shock absorption, and energy storage. And examples would be adipose or fat tissue and connective tissue. The epidermis is a protective barrier, and it produces keratin, which makes the skin tough and waterproof, containing melanocytes, and which produces melanin. And then it's made up of stratified squamous epithelial tissue. It has no blood vessels and can consistently shed and be replaced. And then how it supports homeostasis: it prevents water loss, protects against infections, and regulates UV exposure. The dermis, it provides strength and elasticity, and then it houses sensory receptors, and then regulates body temp and through sweat glands and blood vessels. And the structure is dense connective tissue, contains nerve endings, hair follicles, sweat glands, and subaqueous oil glands. The blood vessels help with the thermoregulation. How it supports homeostasis: it senses temp regulation or temp changes, and triggers sweating, adjusting blood flow to maintain like internal balance. And then hypodermis, the subcutaneous layer, it cushions and insulates, stores fat for energy, and contains skin to underlying muscles. And it's made up of adipose or fat tissue and loose connective tissue. Thickness varies on age, genetics, and body composition. How it supports homeostasis: stores energy, regulates body temp, and protects internal structures. How the skin maintains homeostasis: temp reg, when hot, sweat glands produce sweat, blood vessels expand, which is called vasodilation, to release heat. When cold, blood vessels constrict to retain heat, and shivering helps generate warmth. Protection against infections and injuries: epidermis blocks pathogens from entering. And then platelets and clottings help heal wounds. And then vitamin D is produced and essential for calcium absorption and bone health. How does deepen my understanding? At the beginning, I barely knew anything about the skin. I just knew it was the largest organ. But doing lab number 6, the skin integumentary system, I was able to see how each layer coincided with its function, and then it has the diagram of the skin and the 3 epidermis, dermis, and hypodermis layers. And which clearly helps me visualize and understand what is in the specific regions and how those regions are put together for its function. And then throughout the lab, it has like it shows what type of epithelial tissue, connective tissue is used in the skin, and it clearly explains how the day-to-day person's skin has these 3 layers and what their functions are and how they're used to maintain homeostasis. Unit 2, Target 2, Function of the skeletal system. The skeletal system is more than just bones. It provides support, protection, movement, and essential function that keep the body alive. The skeletal system contains of 206 bones in the adult body, along with cartilage, ligaments, and joints, all working to support life. The first thing it does is it supports, provides rigid structure to keep the body upright and maintain posture. The spinal column supports the body's weight and connects upper and lower body. The pelvis and rib cage give shape and structure to the torso. It supports homeostasis by prevents collapsion under body weight by giving form and stability. 2, protection. Keeps the vital organ safe. The function is the skull protects the brain from injury, the rib cage shields heart and lungs, the vertebrae protects spinal cord, and how it supports homeostasis. It prevents the damage to critical organs that control breathing, circulation, and thinking, basically being alive. Movement. Bones act as levers, muscles pull on them. Joints between bones allow for different types of movements. Tendons attached to bones, making movement possible. And then it allows for gathering food, escaping danger in daily activities. Mineral storage. Bones store calcium and phosphorus, which are essential for nerve function and muscle contraction and bone strength. When calcium levels drop, bone releases calcium to restore balance. It supports homeostasis by maintains calcium levels in bloodstream, preventing issues like muscle cramps or brittle bones. Blood cell production, which is hematopoiesis, making new blood cells. The red bone marrow is inside spongy bone. Produces red blood cells, which carry oxygen to tissue, white blood cells, which fight infection, and platelets, which help with blood clotting. And then how it supports homeostasis, it ensures the body has enough oxygen-carrying cells and immune cells to stop the body from bleeding out, getting infected, or getting oxygen deprivation. The next one is fat storage. The yellow bone marrow inside long bones stores fat, which can be used for energy. And then during periods of starvation, the body can break down fat stored in bones for fuel. And it provides backup energy for when food intake is low. The skeletal system maintains homeostasis by regulating calcium levels, producing new blood cells, providing structural and movement, maintaining blood circulation and oxygen levels, protecting the vital organs. How I deepen my understanding is through the lab manual and the lab manual of overview of the skeleton, which clearly states what the skeleton are and what each part of the skeleton is. Also, the notes we have taken that tell me what is in long bones, and the diagram of a long bone, and the difference between compact and spongy bone, as well as the bone formation, bone marking notes, and also the appendicular skeleton notes, and last but not least, the hematopoiesis notes. Together, put together, I fully understand now how each part of the skeleton is more than just support and just our skeleton. It has many more different functions and reasons for why it's built the way it is. And together, it's helped me increase my understanding from the beginning, which in the beginning was basically, I thought bones were just for standing and keeping us upright, but now I understand it has many different key roles in maintaining homeostasis and making sure we can live day to day. Unit 2, Target 3, diagram of a long bone. Long bones are crucial for movement, support, and protection of the human body. The structure of a long bone, such as femur, the thigh bone, humerus, the upper arm bone, or tibia, the shin bone, has several specialized parts, with each having a distinct function. The diaphysis, the strong central shaft, is long and is the middle portion and made up of compact bone and surrounding the medullary cavity, which stores yellow bone marrow. It provides strength and stability, and it supports homeostasis because it protects the medullary cavity, which stores energy in the form of fat. The epiphysis is the bone's rounded ends. It's found at both ends of the long bone, contains spongy bone filled with red bone marrow, covered by articular cartilage. And then it reduces bone weight, and the red bone marrow inside produces red blood cells and white blood cells, which is hematopoiesis. And then how it supports homeostasis is it replaces old cells with new ones. The epiphyseal plate or line is a thin layer of cartilage between diaphysis and epiphysis that turns into the epiphyseal line after the growth stops. It allows bones to grow in length. It hardens into bones, and it supports homeostasis by ensuring proper body proportions. The perosteum, the protective outer covering, is a tough fibrous membrane that wraps around the entire bone. It contains nerves and blood vessels, and then it is the attachment point for muscles and ligaments. It contains cells for bone repair and growth. It supports homeostasis by healing after injuries or fractures. Compact bone is a strong outer layer. It is dense and solid. It's made up of osteons, which are aversion systems. It provides strength and durability, and supports homeostasis by preventing bone fractures and injuries. The spongy bone is found in epiphysis, contains tubercle and houses red bone marrow, and then it reduces bone weight while keeping its strength, produces red and white blood cells, and then it helps by maintaining healthy blood cell levels. The medullary cavity and bone marrow. Medullary cavity is hollow space inside diaphysis. It contains yellow bone marrow, which stores fat. And then the spongy bone contains red bone marrow, which makes blood cells. Then it stores fat for energy, produces new blood cells, and supports homeostasis by providing energy storage, blood cell production. Articular cartilage, the joint protector, is a smooth, flexible tissue covering the ends of bones found in knees, elbows, and other movable joints. It reduces friction during movement and then absorbs shock. It prevents wear and tear. And then what helped me learn was doing the long bone notes, and also I did my STP on long bone, so I had to research very thoroughly about the different parts and how they all work together and what their functions were. And then I also got the help of the notes we took by having Mr. Mimio clearly explain what the different functions were and how they all work together to maintain homeostasis. Unit 2, Target 4, compact versus spongy bone. Bones are often taught as solid, lifeless structures, but they're actually living tissue with different layers and components. Before learning about this topic, I assumed the bones were the same throughout. They were a solid thing, and I didn't realize there were two types of tissues in bones that had a unique function. The two types of bones: compact bone, which is dense bone. It's found in the outer layer of the bone. It is tightly packed osteons or Haversian systems, which contain blood vessels and nerves. It is very dense and strong, and then it provides strength and protection, supports body weight, and then stores calcium and minerals. It supports homeostasis by maintaining calcium levels and acting as a shield. The spongy bone, or the calcaneus bone, is found at the ends of long bones in the epiphysis, inside flat bones like the skull and ribs, and has porous honeycomb-like structure made of tubercle and lighter and lesser dense than compact bone. It reduces bone weight, contains red bone marrow, which produces red and white blood cells, absorbs shock and impact, and supports homeostasis by producing new blood cells, and then maintaining bone strength without excessive weight. So, how they compare is the compact bone is located on the outside, structure is dense, weight is heavy, function is strength and support, there's no bone marrow, and strength is very strong. While spongy bone is inside bones, epiphysis of long bones and flat bones. It's porous, honeycomb like tubercle, and lightweight. It reduces weight, produces blood cells, absorbs shock, contains red bone marrow for blood cell production, and less dense but still provides support. How compact and spongy bone work together? They work together to make the skeleton, which is strong yet lightweight. The bones were only compact bone, they would be too heavy, making movement difficult. They're made only spongy bone, they'd be too weak and fragile. This allows the skeletal system to be both durable and efficient. An example is like the femur bone, which has compact bone on the outside and spongy bone on the epiphysis, which supports the body but it's still light enough for the movement. It relates to homeostasis by continuously remodeling, maintaining mineral balance. For example, calcium storage and release. The compact bone, osteons will break down compact bone to release calcium, and then when the calcium is too high, osteoblasts will use extra calcium to strengthen bones, so break and rebuild bones. Blood cell production, which is in the spongy bone. Red bone marrow constantly produces new red and white blood cells and platelets. This helps replace old or damaged cells. Keeps the body's oxygen level stable in fighting infections and stopping cuts or things like that. And spongy bone absorbs impact to prevent fractures. Compact bone keeps skeleton strong to support movement for internal organs. At the start of this unit, I didn't really realize that there were different types of tissue, and I thought the bones were just one solid thing that all they did was just support weight and were there for posture. But after doing the microscopic lab and taking the notes on spongy versus compact bone, helped me understand how the different structural build of compact bone, like with the osteons and tubercles and the lacunae, really help strengthen the compact bone, while the spongy bone is softer yet has a very important function of making the blood cells for the human body. So it's helped me understand how the bone is not only just for support, but it also helps maintain homeostasis on an everyday basis. Unit 2, Target 5, Types of synovial joints. Joints are essential for movement. Without them, our bones would be rigid and immobile. Before this unit, I understand that we had different joints, but I didn't realize we had so many different types of joints with specific movements. And then I didn't realize some were freely moving and some weren't. Synovial joints are the most common, most movable type of joint in the body. They're found where two bones meet and allow movement. These are unique because they have a synovial cavity filled with synovial fluid, which lubricates the joint and reduces friction. The synovial cavity, a space between bones filled with synovial fluid for smooth motion. And then articular cartilage covers the end along bones to reduce friction and shock. And then the ligaments connect bones and provide stability. Joints capsule surrounding the joints and hold synovial fluid inside. The types of synovial joints and their movements. The first one's a hinge joint, which allows for movement in one plane, like a door hinge. Allows, like in the elbow and the knee and fingers. The loud movement is flexion and extension. An example might be like where you bend and straighten your knee when walking. The second is ball socket joint. Surrounded bone fits into a cup-like socket found in shoulder and hip. It allows for flexion and extension, moving backward and forward. Abduction, adduction, moving away from or towards the body line, and rotation in a circular movement. So it's like the most movable joint. The shoulder allows you to swing your arms in a full circle. The pivot joint, structure and location. A bone rotates around another bone. It's found in the neck between the first two vertebrae, like a forearm, radius, and ulna. And rotation, turning motion, and then your head turning left or right, or rotating your arm to turn your palm up or down. The next is saddle joint. It's concave and convex shape. fitting together like a saddle, or like it interlocks with each other, and it's found at the thumb. And then it is flexion and extension, abduction, adduction, and limited rotation. You can move your thumb across your palm to grab objects and stuff. The condyle joint, which is a rounded bone fits into an oval cavity. It's found in the wrists and knuckles. It's very similar to the ball and socket joint. It allows for flexion and extension, abduction and adduction, moving your wrist up and down and side to side. Plane joint, which is flat bone surfaces gliding over each other like the wrist and corp in between vertebrae. The gliding movement is allowed, and then your wrist shifting slightly when you move your hand. The joints maintain homeostasis by allowing controlled movements to provide stability or flexibility. Disturbing stress like shock and impact absorption, producing synovial fluid, adapting to movements needs. Some joints allow fine motor control, and then hinge, for example, hinge joints in knees when walking and supporting weight, while ball, socket, and the shoulders allow for a wide range of arm movements. It shows that the body can move efficiently while staying stable. How this deepened my understanding. I always thought that there was like maybe one or two types of joints in the body, and they were all the same, because I've always thought that we all had like the same ball and socket joint, but it turns out it wasn't. I found this out when we did the joints of the skeleton notes, and I was able to see and list out the different types of joints, like fibrous, cartilaginous, and synovial joints. And then I was able to picture and describe and provide examples for each type of synovial joint. This helped me like easily understand which joint was which, because it feels like my wrist can go in circles, but it really is just moving side to side and up, and it's just the movement in between which gives it the illusion it's going around. So it helped me clearly understand how our day-to-day basis is involved in so many of these joints, and how these joints help us maintain homeostasis by providing movement and reactions to things that might harm us. Unit 2, Target 6, effects of skeletal system disorders. The skeletal system is essential for support, movement, and protection, but like any system, it can have problems. Before this unit, I knew that bones could break or weaken, but I didn't fully understand how diseases like osteoporosis, arthritis, or scoliosis affect movement and overall health. And there are several disorders that can affect bones and joints. Each one has a unique cause and consequence, but they're all disrupt normal skeletal function. Osteoporosis is weak and brittle bones. It happens when bones lose density and become fragile. The bone loses too much bone mass or doesn't rebuild properly. It can be caused by aging, hormone change, calcium and vitamin D deficiency, or a lack of exercise. Effects are increased risk of fracture, especially in the spine, hip, and wrist. The loss of height, back pain. And then homeostasis connection is the skeletal system tries to balance bone formation and breakdown. In osteoporosis, bone breakdown happens faster than rebuilding. This disrupts homeostasis. Second one's arthritis. When cartilage wears down, which causes pain and stiffness, joints become inflamed and movement becomes harder. The types of arthritis, there's osteoarthritis, or OA, caused by wear and tear over time. It's common in knees, hips, and hands. Then rheumatoid arthritis, RA, an autoimmune disease where immune system attacks the joints, causing swelling, pain, and joint deformities. Defectuses are stiffness and swelling, joint pain, deformities in severe cases, which lead to loss of function. Then homeostasis connection. Joints have synovial fluid to reduce friction, and arthritis, a balance of joint lubrication and cartilage repair is disrupted. Excuse me. Leading to pain and damage. 3. Fractures. Broken bones. They break due to force, stress, or disease. It can be clean break or compound, which is bone piercing skin. Then it's caused by trauma, osteoporosis, or repetitive stress, which is common in athletes. Effects are pain and swelling, loss of function, potential infections. Healing response, forming blood cartilage and new bone tissue to repair the break. Scoliosis, which is a curved spine, is a normal sideways curvature, S or C-shaped. Causes are genetic factors, neuromuscular conditions, and unknown causes. Effects are uneven posture, back pain, breathing problems. And then homeostasis connection is the spine maintains body alignment and balance. Scoliosis, this is disrupted, affecting posture and sometimes organ function. The last one is rickets, soft or weak bones in children. Bones fail to harden properly, leading to deformities, causing vitamin D deficiency, lack of sunlight, and then defects in bowed legs, bone pain and delayed growth, weakened muscles. And then homeostasis connection is the blood regulates calcium levels for strong bones. In rickets, the lack of vitamin D disrupts calcium absorption, leading to weak bones. How the skeletal disorders affect the whole body. Muscular system, weak bones make movement difficult. Joint problems like arthritis limit mobility. Nervous system, fractures in your spine can damage nerves, causing pain or paralysis. The circulatory system, bone marrow inside bones produces blood cells, so disorders like osteoporosis or fractures can affect blood production, which can, this shows how all the systems work together to maintain homeostasis. When one system is affected, it can affect others. How I deepen my understanding is through the radiology board exam, where I got to see different diseases like scoliosis and arthritis. Also, when we watched the movies with different types of bone diseases, like we saw a child with the rickets and what happens to him. So I was able to see what it really does to a person. And together, through both of those, I was able to understanding what causes these skeletal disorders and how their effects can differ, and what their connection to homeostasis is, and how everyday people can also develop these if they're not careful. So this helped me deepen my understanding by understanding how serious effects on mobility, strength, and overall health can affect homeostasis and overall skeletal health.